Hi everyone, welcome back to my channel. This is Dr. Farida Rajan Ibrahim Omasundi. So today we are going to discuss syphilis. We are going to look at the causes, the stages, the symptoms, as well as the complications. If you haven't liked, please do like, share, and subscribe. So what is syphilis? Syphilis is a sexually transmitted infection caused by a bacterium, Treponema pallidum, and it progresses in distinct stages. Without treatment, it can cause severe health complications. So here is a detailed explanation of what syphilis is. Coming to its mode of transmission, syphilis can be spread through sexual contact, mostly which include vaginal, anal, as well as oral sex. But it can also be transmitted from a pregnant woman to her baby, and that is what we call congenital syphilis. And if not treated, it can cause severe birth defects as well as stillbirth. Syphilis has 4 stages. There is the primary stage, the secondary stage, the latent stage, as well as the tertiary stage. So coming to the primary stage, this is where the primary symptom is a painless ulcer, also what we call a chancre, and this typically appears at the site of infection. So it can be the genitals, the anus, or the mouth, and this can heal on its own, but this doesn't mean that the infection is gone. So this stage is highly contagious, especially if there's a direct contact with the chancre during sexual activity. So that's basically it on the primary stage. Coming to the secondary stage, this appears after the chancre heals. So the infection enters the secondary stage, and the symptoms can include skin rashes, often on the palms of the hands or the soles of the feet. Sometimes there are mucous membrane lesions, which include sores in the mouth or genitals. Sometimes there is fever, there's swollen lymph nodes, there's sore throat, and muscle aches. So this stage can last for several weeks to months, and like the primary stage, syphilis at this stage, the secondary stage, is highly contagious during this period. So that's on the secondary stage. So after this stage, there comes the latent stage. So if untreated, syphilis can enter the latent stage. This is where the infection becomes dormant. There are no symptoms during this phase, but the bacteria remains in the body. So this stage can last for years, and individuals are no longer contagious after the secondary stage. But except in pregnancy, this can lead to congenital syphilis. So then we'll look at the tertiary stage, which is the last stage, and this occurs in about 15 to 30% of people who are not treated. It may happen 10 to 30 years after the initial infection, and it can cause severe damage to the organs such as the heart, the brain, the liver, the bones, as well as the nerves. And the symptoms can include, so it can affect different parts of the body, like we've said. If the cardiovascular system is affected, it can cause cardiovascular syphilis, which can damage the heart and the blood vessels. Sometimes if the nerves are damaged, there's damage to the nervous system, it can cause symptoms such as paralysis, numbness, dementia, and blindness. Sometimes at this stage there can be gummus syphilis, where there is soft tumor-like growths on the skin, bones, and organs. So this slide shows an overview of the signs and symptoms of syphilis, what we've discussed on all the stages. For instance, if it affects the mucous membranes, you can have sores in the mouth or the genitals, and so on and so forth. So remember, we mentioned that syphilis can also occur in pregnancy leading to congenital syphilis. So a pregnant woman, if she has syphilis, it can be passed to her baby, leading to congenital syphilis. And this can cause serious health problems for the baby, including premature birth defects, and other developmental delays, or even death. Yeah, so screening for syphilis during pregnancy is very vital to prevent this. If left untreated, syphilis can have a lot of complications. So, like we've said, it can affect different organs of the body. So, if there is neurological involvement, it can lead to neurosyphilis. If there is cardiovascular involvement, there can be cardiovascular complications leading to cardiovascular syphilis, and also other organ damage leading to comatose syphilis. Yeah, so also it can lead to an increase in the risk of HIV transmission. Syphilis can be prevented, and the most effective way to prevent it is by practicing safe sex, especially using condoms or dental dams during sexual activity, and also regular STI testing, especially for sexually active individuals and for those with multiple sexual partners. So it is crucial to test and to use protective measures. Yeah, so this condition is preventable and treatable, but its long-term effects can be devastating if not addressed early. So that was a brief presentation on syphilis. Make sure you subscribe to this channel for more upcoming videos. Thank you.